Force the immune system to make antibodies against the disease by introducing weakened forms of the virus into the body. In other words, they make the disease fight itself.
And there are literally dozens and dozens of vaccines in the developmental stages as scientists look for a way to cure COVID-19, and at least as many legal hurdles to be cleared before bringing a vaccine to market. Here to discuss that subject with us, distinguished professor of international law at FAMU Law School in Orlando, Dr. Jeremy Levitt. Welcome again, Doctor.
Good evening, Fred Laverne.
Well, let's start by asking about President Trump. He has said a vaccine could be ready by the end of the year. How realistic is that timeline?
Well, realistic is one question and effective is another question. We know that the vaccines that were developed for measles, mumps, polio, rubella, smallpox, and influenza took about 10 years and about $1 billion of research. So in rushing this, we also risk what happened with the smallpox disease and polio, where you had a lot of people who were infected with the virus accidentally. So I think pushing too fast is not good because you have to move from animal trials to human trials. And the question is, what animals are being used? Is there a cross-species analysis being done for the effectiveness of the disease? And on top of that, you have to have volunteers in our system to test on people. Which people are going to volunteer to be tested, and are there going to be some racial and economic inequalities there? So I think we're moving too fast. The science needs to speak to the science. The economy shouldn't be speaking to the science.
And Doctor, when a vaccine is developed for COVID-19, and we all hope it is, how long would you expect it to take to reach at least the clinical phase?
Well, it just depends. Every test is different. Originally, they were saying it would take at least 13 months from Dr. Fauci at the CDC. That, quite honestly, seemed unrealistic. My experience working on health issues at the World Bank would say that we're probably at the closest 24 months, but they're pushing fast. And the problem is that when there's a rush to open the economy and a rush to open a pathway to a vaccine, we got to look at what is the root of the rushing, and it seems to be money and not public health. And this is going to be a problem if scientists don't follow proper protocols that are in place to protect human beings during a public health crisis.
So what would be the vetting process of a vaccine from a legal point of view?
Well, there are protocols in place for testing. It's driven by science. And these protocols, which are, I would say, are standards, that have legal import, drive the process, but it's really based on science. So the structure is in place, and once you test in ferrets or bats or rats, and you see that there is a progress in the testing, then you can move to human trials. But that process typically takes years. So we're moving very fast. And I can tell you it's scary because, as you've seen with the antibody testing, the testing for the coronavirus, there was a rush in terms of companies to cash in on it, and they were getting it wrong. And even to this day, we have a 30% miss rate, meaning that 30% of the people are either tested positive or negative for the coronavirus, and that 30% rate is wrong. It's a 30% fail rate. So what will happen with a vaccine? And I think we have collaboration across borders with different countries, between China and the U.S., with Europe and the U.S., but it should be driven by science. If we move too quickly, we're going to see a spike in lawsuits, and we don't know how many people could be adversely affected.
And before we let you go, one more quick question on that subject, Doctor. Say something, what are the barriers, the borderlines for something to make it from, say, Europe to the United States and to clear the FDA hurdle here?
Well, obviously there's joint science and there's joint trials. The FDA and the CDC monitor the process. They're doing the bulk. The National Institute of Health is doing the bulk of the financing. And so what standards they're looking at to authenticate whether a vaccine makes it through the first trial, which is the non-human testing, and the human testing hasn't been accurately communicated because most of those rules and protocols have been waived given the pandemic. So the clear answer to that is the public doesn't know. We don't know what the standards are right now, and I think that's probably the most scary thing. As we move to human trials, the question will be, will people not just be given full disclosure of what they're going to introduce themselves to in testing, but will there be a remedy in the event that the human testing fails and people become sick?
Very troubling things. Thank you so much, Dr. Jeremy Levitt, Professor of International Law at FAMU. We appreciate you joining us.
My pleasure. Thank you.
For the coronavirus. And then there's the financial piece. A new, more muscular CARES Act package is in the House of Representatives pipeline, more robust than the original $2.2 trillion blockbuster signed into law March 27th. Now, joining me now to discuss all of this and CARES 2.0, if you will, is Dr. Jeremy Levitt, distinguished professor of international law at FAMU. He's in Orlando, Florida. We welcome you back, Doctor. Good to see you again, sir.
Good evening, Fred. Nice to be with you.
It's a long proposal, we know, but let's get your take about what this new CARES package, the main points that the new package is proposing.
Well, the difficulty is we don't know what package is being proposed. We know that Bernie Sanders and Kamala Harris, our two Democratic senators, have proposed the Monthly Economic Crisis Support Act, and that's to give disbursements of money to the American population based on income from $2,000 a month downward for 3 months, and perhaps money after that point, blocking debt collectors from seizing assets, hazard pay for frontline workers. But there's a lot of resistance to this by Republicans because of the last CARES Act stimulus package. They want to see what comes of the money. And of course, Senator Mitch McConnell won't move forward with anything if there aren't legal liability limits for businesses and manufacturers that are essentially employing workers. And the real concern there is patrons, people who will come in and be a part of the regrowth of business and lawsuits from trial lawyers. So unfortunately, I think we're at a loggerheads with that. Of course, the White House wants to look at tax cuts for businesses and investors, as the White House always does in this administration, looking out for those who have wealth as opposed to those at the bottom.
And, you know, you're exactly right. And this CARES 2 package is trying to really get fast-tracked through. We talked to Representative the other day who said that. But what about the original act and what it hasn't done? And that's put needed dollars into the hands of small businesses, disproportionately Black, who need those funds in order to survive. Has that ship already sailed for those businesses?
Well, I think the idea in the act was based on a flawed theory, and both Democrats and Republicans have liability here because they passed it. The idea was that they would have an entrenchment of money for smaller banks and community lenders. And because these banks are more located in rural areas and in urban areas where minorities might be, there would be this kind of trickle down where they would be able to have access to more community-like banking. But the reality is, and what we have to keep track of, is when we begin to look at the numbers of minorities and minority businesses that have received stimulus money, we're finding an enormous disproportionate spread of wealth, meaning the money is not trickling down. And obviously, it takes some kind of technical assistance to actually go through the entire application process. Many of the minority businesses don't have that technical expertise. So minority businesses and minorities who are the most grossly affected by COVID-19 are being left out of the picture when it comes to federal support and financing.
Now, on to CARES 2 again, it does promise in some way, shape, or form, whatever gets through, to involve more dollars. Senator McConnell, as you said, wants to pump the brakes on this thing. But what assurances do we have that there will be more and better transparent oversight over this process involving watching what the Republicans do?
So this is, of course, another tug of war between Democrats and Republicans. The Republicans in the White House want less oversight, and obviously the president has demonstrated his willingness to fire inspectors generals and others whose job it is to do oversight, from the intelligence to foreign policy to economic affairs. So here I think the problem is going to be Nancy Pelosi and Mitch McConnell, both the House and the Senate, are going to bump heads on what kind of oversight there might be. And I think it's going to be a difficult tug of war. There has to be some oversight. And this is what institutions that exist already are supposed to do, like the Equal Opportunity Employment Office. like the Department of Labor. They're supposed to ensure this already. So we're not sure what the outcome of that's going to be, but we certainly know that we not only need oversight, but we need the empirical data to study it to ensure that there is not the disparate distribution of wealth that we've been seeing in the last 2 or 3 months.
And Dr. Levitt, one final question before we go. Everybody's kind of waiting for the rescue squad to come in. It may not get here. So what can people do, especially of color, to help themselves through these desperate times?
Well, I think you got to go to your community banks where you bank and have a discussion with your bankers about getting access to the funds that are available, other loan programs that may not be a part of the stimulus package that are available, using your bank to be the go-between between you as a business or an individual and the SBA. There are many African Americans, for example, that are employees that have 1099s, and they're not aware that they have access to the PPP funding that's available because they're individual contractors. The other thing is to pay particular attention to the Equal Employment Opportunity Commission in the Labor Department, because they can come out with guidelines that will work from everything from safety to fair treatment in business relationships. The reality is that if African Americans don't demonstrate that they have a voice right now, we will be left out of the picture, as will other minorities. And given the amount of money and the fact that these very people who need the money are going to be paying for it through their tax dollars, that would be an absolute tragedy going forward. Everything is affecting us more than any other group, from the effects of the pandemic to joblessness. So we have to use our voices and use our political representatives to ensure that we get our fair slice of the pie.
He is Dr. Jeremy Levitt, a good friend of the program, distinguished professor of international law at FAMU in Orlando. I promise you one day we will have you on to discuss some good news. I don't know when that's going to be. But thank you for now, sir. Be safe and have a good weekend.
You too, Fred. Be safe now.
Thank you.